Good afternoon, everyone. My name is Pascal Alote, and I'm the Director for the Department of Sexual and Reproductive Health and Research at the World Health Organization in Geneva. Excellencies, distinguished guests, delegates, colleagues, it's a pleasure to welcome you to today's discussion on the centrality of sexual and reproductive health on health, well-being, and sustainable futures. I'd like to thank the governments of Mexico, Thailand, the United Kingdom, and the United States for co-sponsoring this event and for their work promoting sexual and reproductive health within their national health systems. Please ensure that all mobile devices are switched to silent. Although this is not a closed event, you are welcome to take and post photos. A reminder that we are being recorded and live streamed. If you prefer not to be filmed, if you haven't had permission from your officers to be here, you may wish to leave the room and follow the live stream instead. And to those watching online, although this is strictly speaking not a hybrid event, we appreciate your engagement. So, straight in, what do we mean by the centrality of sexual and reproductive health and rights? Over the next 70 minutes, we will talk about what it means for countries and governments and what it means for individuals, specifically young people, including very young adolescents. I'll be sharing the moderation spot with Dr. Atul Gawande, so I don't put you to sleep after your lunch. There will also be an opportunity for you to participate through some Slido questions that will be presented by my colleague Sarah Kessler in a little while. So have your phones ready, but still on silent, please, and get ready to pull them out when we're ready to participate. Sarah, can we start the presentation, please? So, Article 3 of the Universal Declaration of Human Rights affirms my right and your right to live free from interference or coercion and to make decisions about your own body and life. Article 12, the right to privacy, including personal autonomy and decisions relating to your body, health, and intimate relationships. The right to health under ICPD, Article 5 of the Universal Declaration for Human Rights, and other international treaties prohibit forced medical procedures or treatments that violate your body, integrity, and autonomy. Other instruments guarantee non-discrimination, informed consent, and reproductive autonomy. All of these are central to sexual and reproductive health and rights. The one thing that I have, that I own, is my body. What I do with it, who I share it with, through intimacy, through motherhood, has to be my choice. And I have to be able to rely on a health system that provides preventive and promotive interventions, including contraception, comprehensive abortion care, antenatal care, cervical cancer screening, protection from sexually transmissible infections, testing and treatment, and one that protects me from violations and mutilation, and upholds these rights by ensuring that individuals have access to accurate information, respectful care, and the full range of sexual and reproductive health and rights services. Next slide. I have the privilege of directing a superb team of researchers in the UN Special Program for Human Reproduction in generating, collating, and translating the evidence base on which global standards have been set for sexual and reproductive health that has informed the work of WHO, UNFPA, UNDP, UNICEF, and the World Bank. This work is undertaken with academic and research institutions and grounded in the realities of individuals in diverse settings through our engagement with civil society. The evidence on the safety and standards for various contraceptive methods, antenatal care, management of postpartum hemorrhage, preeclampsia, HPV, and vaccines, safe abortion, political prioritization of gender-based violence as a public health concern, the impacts of outbreaks, global adolescent study, and access to safe services for youth are all generated through our department. These have all required rigorous, high-quality research that brings the science together with the need to meet the goals of gender and reproductive justice, gender equality, and women's empowerment to ensure that we can survive and thrive as reproductive beings, as well as productive and healthy members of society. Next slide. SRH provides a powerful litmus test for the robustness of health systems. A health system capable of delivering comprehensive sexual and reproductive health services shows the overall strength and effectiveness of a primary healthcare system within the context of universal health coverage. By assessing the availability, accessibility, and quality of sexual and reproductive health services, health systems can determine areas for improvement and allocate resources more effectively to strengthen primary healthcare systems. Next slide. But we need to constantly monitor the context in which we work. We know that the global contexts are changing. 32 million women and girls of reproductive age today live in emergency situations. We have rising concerns of the increasing reports of sexual violence with the growing conflicts and increased rates of gender-based violence in conflict and humanitarian settings. Our sister agencies, particularly UNFPA, are at the coalface of service provision, but there is work to be done on the transferability of implementation research evidence. The provision of care, including in complex humanitarian settings, needs to be evidence-based. SRHR needs to be core to pandemic and epidemic preparedness efforts and climate mitigation and adaptation strategies. Next slide. This means that our work has to be constantly evolving as much as our context is. Sustainable futures refers to the concept of envisioning and working towards a future in which human societies thrive within the ecological limits of the planet, ensuring the well-being of current and future generations. It means promoting fair and equitable access to resources, opportunities, and services for all members of society, regardless of gender, race, ethnicity, socioeconomic status, or other characteristics. We will be launching on the sidelines of the World Health Assembly a technical report that covers and that provides us the opportunities to be futures-oriented in the centrality of SRHR to ensure intersectionality, inclusivity, and universality, that the work that we do is about people in all the diversities, that we consider the different sites of risks and settings, that we explore systems as problems and solutions, that we properly evaluate the promise and risk of technologies, and that we anchor our work with our partners. Next slide. Now, we also know that there is a strident resistance to sexual and reproductive health and research and rights, and I'd like to think that it is from a minority, a very loud and ever-present threat. It will remain a challenge fueled in part by geopolitics, the need for wedge issues in elections, and a broader pushback against shifting power, whether within the domestic confines of the home, the corridors of the corporate world, or the need to relinquish privilege in the interests of equity. All this is to say that we hear when things go wrong, but not enough about when things have gone right and the realities of how change happens. This means that progress is possible in spite of the challenges and pushback, and in fact, in some cases, because of the challenges and pushback. This then presents me with the opportunity to have a panel of members from a range of countries who are going to tell us about their bravery in pushing back and really showing how things change. Sarah, do you want to please project some slides, some questions? And this is an opportunity to ground ourselves in this discussion and to share our understanding of the evidence, but also to reflect on what SRHR means for us on a personal level, and one of the great privileges of working in this space. Your answers will be anonymous, but they will be projected. Sarah, over to you.
Great idea. Very quickly, as Pascal said, it's a busy week. We have double duty events, acronyms, sleepless nights. Let's just ground ourselves in the discussion at hand and be in the room together in person here, and also not forgetting all the people who are watching online. So the first question, if you could take a look, this is really reflecting on the centrality of SRHR, which is the theme of this event today. So thinking about which SDGs SRHR is interlinked with. Are you able to access? Either use the QR code. Voting is closed. Luckily, that's not true. Swiss time, indeed.
We are 2 minutes over.
Okay, if you could try one more time. I think we can all agree that that was not the message nor the... It's good to know why we're in this room together, and I think that we'll maybe just pass back to Pascal and let this technical issue correct itself. Okay. My apologies.
Okay, no problem. So I'm going to go into the middle section, which is of this session, which is to hand over to representatives from 4 of our member state co-sponsors who will give statements highlighting how and why they have successfully approached centralizing sexual and reproductive health and rights and the tenets of ICPD to achieve progress on health and intersections with key sustainable development priorities. Each speaker has been requested to give 3 minutes of remarks, recognizing that we may give you a little bit of leeway, but 3 minutes would be awesome. So, from the United States of America, it's my pleasure to welcome Dr. Atul Gawande, who is the Assistant Administrator for Global Health at USAID.
Thank you, Dr. Alate, and thank you for everybody who's joined for this side event. The SDG goal that I want to zero in on is SDG 3, which sets a number of goals for advancing equity in health, including targets for advancing child and maternal survival, critical goals for HIV, TB, malaria, and advancement of universal health care coverage for all. None of it can be done without respecting individual autonomy over one's body and life, a core principle of the Cairo Consensus. Number 2, none of it can be done without family planning services and reproductive health services that allow women to choose when and whether they wish to have children and how many, and then to have safe childbirth access and provision of care. And none of the goals, the SDG 3 goals, can be accomplished without providing dignity and security in health services for everyone, not just for the few. The U.S. has been committed to delivery on the goals of ICPD for the last 30 years, and included in that is the goal of advancing sexual and reproductive health and rights. the focus on service delivery and community-based primary health care, which we've been applying with greater and greater coordination of our services, has been focused on primary care as the essential scaffolding for assuring at the community level access to these rights and to these critical parts of care. We have been the largest bilateral investor in family planning and reproductive programming, working in more than 40 countries. And we have now worked in a core of 12 countries in our primary impact initiative to align our investment in services in ways that bolster and strengthen the community health workforce, the primary care clinic capacity, and then ultimately the delivery of services across the lifespan. In 2023, as a result of the family planning services that we've supported, we have seen that it has reached 24 million women and girls, averted 8 million unintended pregnancies, averted 3.2 million unintended births, averted 2.6 million unsafe abortions, and saved more than 14,000 of women's lives. We have, as noted, entered a space where it can feel that the gains we've made over the last 30 years are now at threat or have become contentious. But I think the reality of making these services and these rights available at the local level through community-based delivery and community-based education and action is the reason why we're actually here. It's the success of this work that is driving some of the backlash and contention. The making it a reality, what it means to have autonomy over one's body and one's life, autonomy over one's marriage, autonomy in the context of sexuality. All of that has pressed on systems and on expectations in ways that have generated enormous impact and enormous good, but also some pushback. And we're here to keep that progress going. Thank you.
Great. Thank you very much. I really do want to appreciate the US's leadership in this area, and particularly the last comment. I wish we would have enough time to have a little bit of a discussion actually about the goods and the bads of the successes, and how we work forward with the lessons that we've learned about the progress that we've made. Thank you very much. So from Mexico, it is my pleasure to welcome Yolanda Varela, the General Director of the National Center for Gender Equity and Reproductive Health. Yolanda?
Thank you very much. Good afternoon. Es para mí un verdadero honor participar en este importante evento en el que estamos conmemorando el 30 aniversario de la Conferencia Internacional sobre Población y Desarrollo celebrada en El Cairo, Egipto, en 1994. Agradezco la invitación que se hizo al Gobierno de México para participar en este foro y saludo a todas las personas aquí presentes. Quiero iniciar mi presentación señalando
So if we could have the mic over here at the same time, if it's even possible, that would be great. So it's an honor for me to participate in this important event in which we are commemorating the 30th anniversary of the International Conference on Population and Development, held in Cairo in 1994, and I appreciate the invitation made to the government of Mexico to participate, and I am very glad to see everyone here and greet everyone. Okay, there you go.
Thank you. Quiero iniciar mi presentación señalando que en México es una prioridad hacer realidad el ejercicio de los derechos sexuales y reproductivos de la población. Por ello, todas las acciones que hemos impulsado en el país están alineadas a 3 documentos importantes. El Plan de Acción que se suscribió hace 30 años en El Cairo, Egipto, en el Consenso de Montevideo adoptado en Uruguay en 2013 en la región de América Latina y el Caribe, así como en la Cumbre de Nairobi de 2019.
I would like to begin my presentation by saying that for Mexico it is a priority to realize the sexual and reproductive health and rights of our population. In that regard, all the actions that we have proposed in the country are aligned with three major documents. One is the Program of Action that we signed 30 years ago in Cairo, Egypt, as well as the Montevideo Consensus adopted in Uruguay in 2013 for the Latin America and Caribbean region, and the Nairobi Summit of 2019. In this summit, we established three goals: ending all maternal deaths, zero unmet need for family planning, and no gender-based violence and harmful practices against women and girls by 2030.
A lo largo de los últimos 30 años, hemos aprendido en nuestro país que para avanzar en el ejercicio de los derechos sexuales y reproductivos es fundamental considerar 4 aspectos. Número 1, establecer políticas públicas que estén perfectamente alineadas a la planeación estratégica nacional. Número 2, actualizar y armonizar el marco normativo y regulatorio en el que se sustentan las políticas públicas en la materia. 3, impulsar la coordinación interinstitucional e intersectorial, ya que se requiere de esfuerzos compartidos para crear las condiciones necesarias para favorecer el ejercicio de los derechos sexuales y reproductivos de todos los grupos de la población, sobre todo los de mayor vulnerabilidad. Y finalmente, establecer alianzas con la sociedad civil organizada.
In the past 30 years in our country, we have learned that in order to progress towards the exercise of sexual and reproductive health and rights, it is fundamental to consider 4 aspects: establish public policies that are aligned perfectly with national strategic planning, update and harmonize the regulatory framework in which public policies are based, promote and favor interinstitutional and intersector coordination, since shared efforts are required to create the necessary conditions to promote the exercise of sexual and reproductive rights for all population groups, especially those in situations of greatest vulnerability, and finally, establish alliances with organized civil society.
Un ejemplo de la importante participación de las organizaciones de la sociedad civil en México ha sido la elaboración, publicación y difusión de los derechos sexuales y reproductivos para adolescentes y jóvenes, que enumera y describe los 14 derechos que hacen posible el disfrute pleno y placentero de la sexualidad y además favorecen el bienestar físico, mental y social de la población.
An example of the important participations of CSOs in Mexico has been the development and publication and dissemination of the Sexual and Reproductive Rights Booklet for adolescents and young people, which lists and describes the 14 rights that make possible the full and pleasurable enjoyment of sexuality and promote physical, mental, and social well-being.
Para dar cuenta de los avances que se tienen en México en el ejercicio de los derechos sexuales y reproductivos de la población mexicana, la Secretaría General del Consejo Nacional de Población ha publicado este documento con los avances en el conjunto del país, así como en cada una de las 32 entidades federativas. En las próximas semanas se publicarán los resultados de la Encuesta Nacional de la Dinámica Demográfica que se llevó a cabo el año pasado, lo que permitirá actualizar estos documentos.
In the Ministry of Health of the Government of Mexico, there are at least 15 key contraceptive methods for temporary regulation of fertility, including emergency contraception, which are provided free of charge to the population. Special attention has been given to the long-acting reversible contraceptives, such as subdermal implants and intrauterine devices in the range of options.
Los esfuerzos en materia de salud sexual y reproductiva han permitido avanzar en varios indicadores. Permítanme aquí señalarles nada más cómo vamos en mortalidad materna. De 1994 a la fecha, el número de defunciones maternas se redujo en 72.5% y la razón de mortalidad materna en casi 60%. Además, hemos logrado revertir el impacto por la pandemia por COVID-19 en 2020 y 2021.
Efforts in sexual and reproductive health have led to a sustained downward trend in maternal mortality, From 1994 to date, the number of maternal deaths has decreased by 72.5% and the maternal mortality ratio by nearly 60%. Additionally, the impact of the COVID-19 pandemic in 2020 and 2021 has been reversed.
En México, reconocemos que tenemos avances importantes, pero insuficientes, por lo cual reafirmamos el Plan de Acción del Cairo. De manera particular, consideramos como temas prioritarios a atender los que se muestran en la diapositiva. Uno de los temas prioritarios es prevenir y atender la violencia sexual y de género, sobre todo en niñas. No podemos permitir un solo embarazo en niñas, por lo que además de los servicios de aborto seguro, debemos enfatizar en acciones intersectoriales para la prevención e identificación temprana de la violencia sexual, así como para la restitución de derechos y para la mitigación del daño a la salud física y mental de las mujeres víctimas de violencia. Además de la reducción de brechas, es fundamental además impulsar la participación de los hombres y favorecer el enfoque de masculinidad en las políticas de salud sexual y reproductiva. Desde luego, todo esto no será posible sin una verdadera educación integral en sexualidad desde edades muy tempranas, en las que se involucre a madres, padres y tutores, así como a profesoras, profesores y principales actores de la comunidad. Thank you very much.
Thank you. In my country, we acknowledge that we have made significant progress, but it's insufficient, which is why we reaffirm the Program of Action of Cairo. In particular, we consider the issues shown in the slide to be priority areas to address. One of those priority issues is to prevent and address sexual and gender-based violence, especially in girls. We cannot allow a single pregnancy in girls, so in addition to safe abortion services, we must emphasize intersectorial actions for the prevention and early identification of sexual violence, as well as for the restoration of rights and the mitigation of physical and mental health damage to women victims of violence. In addition to reducing disparity, it is essential to promote the participation of men and favor a masculinity approach in sexual and reproductive health. We must also reinforce comprehensive education, sexuality education that involves professors, teachers, and parents. Thank you very much.
Thank you very much, Mexico. Mexico has certainly been a real champion, particularly for youth, and a beacon in the region. So thank you very much for your work. The next presentation is from the United Kingdom of Great Britain and Northern Ireland. It is my great pleasure to welcome Chris Carter, the Deputy Director and Head of Human Development Department at FCDO. Chris.
Thank you very much. Thank you for the opportunity to speak. I'll be speaking about sexual reproductive health and rights and SDG 5, which is on achieving gender equality and empowerment of all women and girls. Now, we all know it's impossible to talk about one without the other. How can we say that somebody is empowered if they do not have bodily autonomy? We know that without access to SRHR, girls face disruption to their education. Women and girls lose their ability to support themselves through work. We know that they face risks to their health, even deadly risks to their health. We also know that adolescent girls are particularly vulnerable and threatened without access to SRHR. I think we should call out anyone who tries to argue that you can empower women, but they are against comprehensive SRHR. We should call out anyone who says that. The UK is a powerful champion of SRHR and gender equality. Our Deputy Foreign Minister was here on Monday. He announced more funding and more about what we're going to do to accelerate progress, and we'll be talking more about that over the next 6 months up to the Summit of the Future this year. It runs through all of our work as set out in the UK's White Paper and our International Women and Girls Strategy. And last year, the European Parliamentary Forum for Sexual and Reproductive Rights ranked the UK the highest in the region due to our commitment to SRHR. And I'm very proud of the support we have from members of Parliament. We have one here. As Varela, thank you for being here and championing SRHR. The UK is the biggest donor to UNFPA Supplies Partnership. That programme alone in 2022 averted 8 million pregnancies and 2.2 million unsafe abortions, as well as 170,000 maternal and child deaths. And we fund a number of other programmes with similar impacts. And we're working with others here at the UN to uphold our commitments to SRHR that we have been making and reinforcing over the next 30 years. I think when we're talking about gender equality, we should not shy away from the difficult issues like sex education, like adolescent SRHR, and it was wonderful to hear about Mexico's progress there, and like abortion. And we need to work across all sectors on SRHR. It should not be seen as a secondary issue that belongs to a Minister for Gender or a fringe of the Ministry of Health. It should be embedded in universal health coverage and should be a fundamental part of all health systems. And just to end, and to really stress, there can be no progress on gender equality and women's empowerment unless we progress and we continue to progress on SRHR. Thank you.
Great. Thank you very much, Chris, for really emphasizing the UK's commitment to both gender equality and SRHR, and the bravery in trying to do this both internally and externally within the UK. Last but not least, for this particular panel, and from the Kingdom of Thailand, it is my great pleasure to welcome Dr. Bunyat Sukrat. I hope I said that right. The Director of the Bureau of Reproductive Health at the Department of Health in the Ministry of Public Health in Thailand.
Thank you, Pascal, for the introduction. My talk is about the application of the Universal Health Coverage Scheme to enhance access to sexual and reproductive health services. In Thailand, 20 years ago, when we first established the Universal Health Coverage Scheme in Thailand, the sexual and reproductive health services were included in the universal package from the beginning. It sounds good, but we still face the limitation to access to services. In 2016, Thailand have established the Adolescent Prevention and Solution Act, because at this time we face the situation that our adolescents' birth rate have sharp increasing more than 10 years in a row, and that's the awareness of our society, and we decide to establish the Adolescent Prevention and Solution Act. And when we launched the act, we review our situation and our related policy to tackle with adolescent services. We found an interesting information from our mixed survey, that in the mixed survey we found the contraceptive choice in adolescents, the most popular method in Thailand adolescent is about the pill, the injectable, and the condom. It is common, I think, in every country. These three methods should be the most popular. The interesting finding is that at this time, the long-acting reversible contraception, that means the implant and the IUD, at this time, the proportion of use is only 0.3. The long-acting reversible contraception that is the most effective method, the most long-lasting continuation of use, but only have the proportion of 0.3% at this time. And we found the root cause, and we found that in our Universal Health Coverage Scheme, at this time we pay in the per capita in the prevention package. That means we give 500 baht to all hospitals for all preventive methods. So most hospitals in Thailand have the service already only the contraception that in low unit cost, that they have the pill, they have condom, they have injectable, but they don't have the implant because the unit cost is too high for them at this time. So we talk with the National Health Security Office to change the payment mechanism for the family planning services to the bundle payment that you can see we pay per service. This price, the National Health Security Office pay include the material cost and the administrative cost and add a little bit margin to the provider. That means if they have more services, they can claim more money from the National Health Security Office. After we change the payment mechanism, more than 200,000 teenagers can access to long-acting reversible contraception. Our follow-up mix survey found that the proportion of use rising from only 0.3 to 18% in our latest round of mixed survey. And the implant become the second popular contraception in Thai adolescents, below from the pill. That's still the most popular. And the outcome show that we can reduce the adolescent birth rate in the 15 to 19 to half from 50 per 1,000 to 20 per 1,000 in only 10 years. And the result is impressive, not only for the adolescent pregnancy, but for the abortion. In Thailand, we have changed the law and we have implemented the abortion pill for about 6 or 8 years. At the first time when we launched the abortion pill, the proportion by age group, the adolescent take place about 1/4 of all women seeking for abortion in Thailand at this time. But the latest result last year showed that the proportion of adolescents seeking for abortion is reduced to only 8%. That show the effective of this program. Because the successful in the change in the payment mechanism, the National Health Security Office changed all reproductive health services to the bundle payment, all method and all age group to pay with this like that. And they also expand the service point from the government hospital to the pharmacy network. That will be, we hope that we can enhance the access of services via the service point. And this is our example. Our challenge is in the future, we have planned to include the digital health counseling via digital platform and also the telemedicine into our package also. And we're waiting for coordination from all member countries and the partner organization. Thank you.
Thank you very much. A round of applause, please. Again, Thailand is a particular beacon in South-South collaboration and really leading the way in both universal health coverage and health financing, and particularly embedding sexual and reproductive health services right from the beginning as part of universal health coverage. So thank you again very much for your contribution. I'm not sure if we're feeling brave enough to try Slido again. We are? Okay. So while you set that up, I do want to just note as well that we've seen that the intersection of sexual and reproductive health and rights and SDGs are not just aspirational. It is inherent and has a very positive impact. And the role of member states is fundamental. When you understand and respond to your population's sexual and reproductive health needs and rights, and when you negotiate with evidence, the power to change is significant. Sarah.
I did just want to put this back up and allow us to have the conversation that we'd set out to have together, and apologize for having our own conversation disrupted. So if we could go to the first slide and go back to the question, how are Sustainable Development Goals and SRHR interlinked? And this one is a trick question, moving quickly along because they are all interlinked, which is exactly the reason why we came to this room together to talk about these issues. We also came to talk about primary healthcare as a space for SRHR to be delivered through. So the question here is which services do you understand? Everyone was almost immediately correct. It is indeed the case that the majority of SRHR services can be provided through primary healthcare. This is a question, I think, that we just want to reflect on the accessibility of SRHR as well. It is not universally out of reach. It is universally within our reach. And then our next question, this is personal, and you don't need to put it in the deck as much as it is anonymous, but I think we all in this room have benefited from SRHR services. We all love somebody who has benefited from SRHR services and these rights that we hold. And I think even reflecting for a moment on a personal level what those are, as Pascal said, feels like a privilege of the work that we get to be a part of and also the bodies that we live in.
Fantastic. Thank you, everyone. And thank you, Sarah. And we know that the two big ICPD convenings that happened last month had more than 400 young people gathered in Benin to discuss their priorities. And we also had parliamentarians from 112 countries gathered in Norway. Was it 112 or 172? Which was it? I thought I heard 172 this morning. Gathered in Norway to strengthen their commitments on SRHR. It is now my pleasure to hand over to Dr. Atul Gawande to take his department hat off and put his journalism hat on, and welcome to the panelists and moderate the next session. Over to you.
Thank you so much. I'll put on my facilitator hat here, best of all. And wanted to bring to we can't have this discussion without engaging youth. And our 2030 global agenda will not be finalized without meaningful partnership with youth, who are the majority of the world. And we need to take into account the preferences, approaches, and priorities of youth in all their diversity. Youth development has been a priority for USAID and the U.S. government for a long time. We were the first international donor to establish a youth policy back in 2012. It has then since been revised to take into account all of the advances in understanding of what can be done with youth partners. And so in 2022, we revised our policy to elevate youth to be full partners, prioritizing diversity and inclusion, recognizing how to engage youth at every stage of development of policy, and recognizing the priorities that youth bring, whether it's around climate, conflict, violence, or other priorities that deeply affect the success of young people. So I'm looking forward to this next panel as a chance to hear about the priorities that have come out of the convenings and the individual experiences that our youth panelists will bring. I'm pleased to introduce our esteemed youth panel then. We have, first to my left here, Montserrat Lopez from the World Organization of the Scout Movement, Levi Singh from the SRHR Africa Trust, and Apsana Begum, who is a member of Parliament in the UK Labour Party. I'm going to turn to you with first asking each of you, what do you think is missing from the discussions of the ICPD agenda? Let me start with Montserrat.
Thank you very much, and thank you for the opportunity to be here. I want to start my engagement by saying that we need to understand that young people know what they want and they need regarding sexual and reproductive health, and if they don't, they really want to. We are missing grassroots movements. We need to prioritize support and have clear plans for investment on grassroots youth organizations that are directly engaging with communities to address sexual and reproductive health needs. These local efforts have a deep understanding of the cultural context and specific challenges faced by young people. making them valuable in bringing meaningful change. We also need to start investing in youth-led projects as a crucial part of ensuring that voices and perspectives of young people are considered in decision-making processes. These projects not only empower them, but also inspire other young people to know that they can make a change, that their projects are relevant, accessible, and responsible. And lastly, I want to talk about innovation and how innovation plays a crucial role in advancing sexual and reproductive health. We should be exploring new technologies, approaches, and strategies to improve access to information, services, and resources related to sexual and reproductive health. By embracing innovation, we are not only embracing young people, we are embracing next generations. We are learning as the past generations that change is good, that change needs to happen, and we are changing with it. In terms of the questions that we should be asking ICPD and that we, our young people, are asking ICPD that we need is, how can we ensure that funding and resources are allocated to support grassroots movements and youth-led projects working on sexual and reproductive health? What mechanisms can we put in place to facilitate these collaborations and knowledge sharing between these organizations and the private and public sector? How can we harness technology and innovation to improve access to sexual and reproductive health, particularly on marginalized communities? What strategies can we implement to actively involve young people in decision-making processes of sexual and reproductive health policies that actually have an impact in their quality of life? And finally, how can we prioritize the needs and rights of marginalized groups, including refugees and those living in conflict areas within the broader framework of the ICPD agenda? Thank you.
Thanks for Thanks for that, Montserrat. Before I go to Levi, I want to ask, can you say a little bit about yourself, where you're from, and how you're engaged? You talked about grassroots movements and technology. Are those things that you have been engaged in trying to work on directly yourself?
Yes, so to talk a little bit about myself, I am currently the manager on health and well-being for World Scouting. And we talk about how can we empower young people in many things. And we realized that health was an issue in communities, that young people were taking action, and we needed to support. So we are experts on how to make grassroots movements and how to make change from the bottom to the top. And we believe that young people are a drive force to make change. And how technology is not an enemy, it's actually a benefit, and we need to take advantage of it. We need to take advantage that we are recording the session, that we can use Slido, and that young people, they love technology. And how can we actually make technology work for our benefit? And don't let the ICPD agenda stay 30 years ago, but bring it forward with technology.
What country are you from originally, and are you working the World Scouting movement in a different location?
I am originally from Guatemala and working in the global office in Kuala Lumpur.
Okay, wow. It's very, thank you for all of your contributions. Levi, tell us a little bit about yourself along the way and the SRHR Africa Trust, and then what you think is missing from the discussions.
Thank you, Dr. Atul, and greetings to everyone. My name is Levi Singh from South Africa. I work as the Regional Policy Officer at the SRHR Africa Trust, also here supporting the South African delegation. At the SRHR Africa Trust, we work on adolescent and youth sexual, reproductive, and health rights across the African continent. Our focus is really linking young people to SRH services, to information, education, counseling, as well as to decision-making spaces. So we have a program on meaningful youth engagement, participation, and leadership, and it really looks at cultivating the next generation of SRH leaders on the continent. And the last and equally exciting bit, touching on what Monse just said, was really looking at our work around tech and innovation. So we have a platform called YouthWise, what we term as a low-tech digital health intervention, which really looks at linking young people to health services via their mobile phones. In our last evaluation, we reached 5.5 million young people with health information and linkages to services on a weekly basis. So we're really trying to leverage those accelerators, and we're trying to target young people where they are in linking them with the services through our work at STAT. But coming to the question on what's missing within the ICPD POA. So I've had the privilege of working on the POAs for the last 12, 13 years now. My first engagement with the POA was when I was 17 years old, and now I'm on the cusp of 30, so I turn 30 as the POA turns 30. And I think I'm going to be a bit frank. I think we've addressed the issue of resistance towards the POA, and I want to delve into that a bit more. I don't think that we've done well in crafting a shared narrative as to why the POA is relevant and important. I think what we've done is we've allowed the resistant forces to box in the POA to just SRHR. And that's because we haven't told the story. We haven't told the story of how the POA is relevant to other movements and other emerging issues that are covered in the POA. Climate, migration, education, decent work, etc. Some of the most pressing challenges of the 21st century covered quite extensively within the POA, but we've allowed the resistant forces to isolate SRHR as the overall POA headline. And I think what we need to do better in the next 30 years is, well, not the next 30 years, but hopefully the next 70 months between now and 2030, we need to reclaim the narrative. And I think we've started to do that. If any of you have had the privilege of reading the Continued Youth Action Agenda, we've done it as young people. We've said that the POA is relevant because it goes so much further than our sexual, reproductive, and health rights. It talks to the priorities that we want to see, not just for our futures, but also for the future generations that will precede us. So I think reclaiming the narrative, crafting different narratives, building cross-movement support and solidarity to keep the POA relevant, especially in the context of a post-SDG world. We know that the discussions around the post-SDG future is already starting with the Summit of the Future, and I think keeping the POA front and center to inform those discussions is something that we're already starting to do as young people. And I will just speak in my African capacity to round up. I think we may have a great political declaration out of the CPD, but ultimately the real work will come through from what happens within a sub-regional and a national level. On the African continent, we have the Addis Ababa Declaration on Population Development, which is a 10-year-old African position on the ICPD POA. And it talks very authoritatively to issues around adolescence. It talks about issues around sexual, reproductive, and health and rights. So I think it's really about us reclaiming some of these African instruments and positioning these African instruments as the next generation of ICPD leaders, because I think that's currently what is missing.
Can I ask Levi to, for 2 more minutes of thought on, we've seen retrenchment, whether it was in Uganda, in Ghana, in Gambia, on many fronts, and finding coalitions that are bringing African voices to the fore, like you are providing, has been critical. Do you feel that set of voices are missing or not heard, or is it, you talked about the narrative, that we haven't recaptured the narrative? So I'd love to hear a little bit more about your sense of what does it take to bring those voices forward and offer a narrative that might advance the cause.
Thanks for the follow-up question. So I have a bit of PTSD for this room in particular. So last year, we spent a large part of 12 hours in this room talking about the outcome document for the CPD 56 last year. We know that we ended up without an outcome document. And what we had seen play out and what we continue to see play out is the case of a vocal minority and a silent majority in terms of the Africa group. And ultimately, I think what we need to do more of as a development community, as a progressive community of civil society actors, is to assist some of the member states who are doing incredibly impressive work in some really resource-constrained settings to amplify some of that work. I think there were many member states from Southern Africa last year and even this year that have taken the floor quite authoritatively to talk about the work that they're doing domestically on comprehensive sexuality education, on access to safe abortion, on meaningful youth engagement, participation, and leadership within SRHR decision-making and health decision-making spaces. So I think we really need to invest in amplifying the voices from capital, because sometimes there is this profound delinkage between the very progressive and very meaningful work that is happening at a country level and what is communicated within the African Union space in Addis Ababa, or even here through the missions in New York. So building bridges and ensuring that the good work that is being done back home is amplified. So investing in that supply chain of storytelling and narrative curation is really important, I would think.
Thank you for your work doing all of that. Afsana Begum, a member of parliament in the UK, I'd love to hear a little bit about how you came to choose to pursue public office, in addition to what you've learned indicates what is missing that you see.
Yeah, I mean, I was, well, thank you so much. It's an honor to be a part of this panel. I was elected in 2019 at the age of 29. When I was elected, it was deemed that the UK Parliament had become the most diverse it's ever been. So I think the MPs from all parties that were elected in 2019 helped definitely make it more diverse, younger, more from ethnic minority backgrounds, more colleagues from with disabilities, and younger as well, and more women as well. So that's interesting in the context that we now operate in the UK Parliament. And my journey was not conventional. I didn't, go through a political school, and have a journey in that sense. I was very much involved at a local government level, and my interest was really sparked by campaigns that were trying to ensure that services for women and children could be protected from privatisation, effectively. And the reason for that is because we could see that those local services were, run by local women for local women in particular, and that without policies such as universal childcare, it makes it very difficult for women to be able to access childcare and to return to work or to pursue other interests in particular. I, since being elected, also came forward as a survivor of domestic abuse, and I think that has also had an impact in terms of how I drive my political activity in Parliament and the campaigns that I concentrate on. That's my background in terms of my journey to Parliament. I think it is interesting that as a younger person in Parliament, the perspective of bringing various different issues through lived experience, because I think sometimes, the argument can be that, well, are you inexperienced? Do you have the knowledge? Do you have the background? But actually, there are various different policies globally and, nationally in the UK that have meant that young people have missed out on a lot of opportunities, have lived through the impact of certain policies that then means that they do become politicised, sometimes at an earlier age, and do enter local, national and international politics. So it's good to see initiatives like the ICPD 30 and the Global Youth Dialogue that took place a few weeks ago. Coming to your question around the ICPD agenda, I was going to mention that I think that the context of the impact of climate change, conflict, humanitarian crises, and economic instability is absolutely critical. I wasn't at Benin for the Global Youth Dialogue on ICPD 30, but I do think that we need a more comprehensive, open and honest discussion about the impact of wealthy interests. And that includes loans, privatization, as I've mentioned, and financialization, and the legacies, the ongoing legacies of colonialism and the ongoing reality, I would say, of imperialism as well. I think most of us will know or will agree that climate change is rife with international injustice and inequality. And it's the least polluting countries that are at the sharp end of all that chaos. I would say that there are inequalities between countries, but also within countries, and that's rooted, with historical socioeconomic differences, what I call structural racism. And one of my reflections as a younger person, and getting elected just before we went into the COVID-19 pandemic, I felt that crisis demonstrated the problems of private ownership of the most profitable parts of the global healthcare sector. In that it's unsustainable. I think it takes resources away from understaffed frontline health services all around the globe. And there is, on the one hand, the need to increase resource allocation, strengthen primary healthcare services, which has been mentioned already, but also motivating the human resource element, employed in the healthcare sector through good governance. I think that's really key. These are really big issues, but I do think we can't afford to be afraid of tackling the big issues, actually.
I think we have time for a full another round, and I would love to try to unpack some of what we've put on the table, and we won't get to all of it, but you have some really deep and important topics to get to. I want to start with some of the items you brought up, Montserrat, which were around grassroots level connection, technology, and harnessing the good when we see so much that feels like we're seeing the bad. There was a study just came out recently out of Norway where they studied what had happened when about a quarter of the schools in Norway banned cell phones during the school day. And what they saw was a substantial reduction in gender-based violence, in improvement in mental health, improvement in reduction in bullying, and it was, and the primary benefits were for females, and sort of middling results for the boys. And I wonder what you make of that, and how you think about the intersection between mental health and where we are, and technologies, and the directions that we, and how we begin to think about this as part of the agenda you were getting at.
Thank you for the question. I think one of the many good things we do at World Scouting is understanding challenges by young people. We have now a reach of 57 million people, which is 57 million communities. So we became very diverse on how to understand challenges that can be very different from many regions. Regarding that specific one, we truly believe that the most meaningful investment in education and non-formal education can lead to our young people to believe they can improve their mental health, they can improve their soft skills, and by improving their mental health, their soft skills, they will have more opportunities at school, like you were saying, at job enhancement and economic opportunities. They will not have limited access to trainings because we are investing on it. So I will say that in order for us to achieve the ICPD agenda, innovation is not only on how we are addressing sexual and reproductive health rights, but how we are also addressing a more holistic approach toward health. And that sexual and reproductive health implies everything. When we talk about sexual and reproductive health rights, we talk about empowering young people, empowering everyone on believing their mental health is important, that there are many different ways that they haven't learned, that they can learn, that there are many activities that they can get involved, and obviously we believe scouting, it's a very fun one for them to get involved, but how can these opportunities not only break the breach between their rights, but break the breach between every single aspect of their lives, and how they get involved in jobs, how governments are actually making the private and public sector accountable for for eliminating poor work conditions, and well, life skills, most of it. Sexual and reproductive health rights are also about life skills. Are we teaching young people about mental health literacy? Are we teaching young people about leadership, about time management, about emotional intelligence? Or are we just providing health services? Are we having a holistic approach towards education? Is the ICPD agenda broader enough to understand that we need to talk about comprehensive health education per se, and how can we make health education not only available, but relevant for young people, because we often have discussions on health between very grown-ups, adults, people that are very well equipped from school, from life experiences, but are we making it accessible for young kids, for parents that they don't have the privilege to be at school, but they want to teach their kids about rights, about healthcare systems, for teachers that do not operate on a very well-trained level, but they still have the willingness to work on it. So the way to overcome barriers on sexual and reproductive health, on my perspective and on WASM's perspective, is that it's a broader issue, and education is at top of it, and education has many levels. And investing, in this case, for example, taking away their phones, it's bringing us back to the connection that young people should have and the non-formal education part of it. Thank you.
Thank you. Levi, I'm going to pick up on this going in a slightly different direction. It might have been the question you've been prepared for. So apologize in advance. So I was in my father's village. My father's from a rural village in India, and I was there just a few weeks ago. And I connect with my nieces and nephews, and then my generation of farmers mostly there. And the young people have a world available to them through their phone that they get to see, that has a different set of standards, values, complexities that come along with that, and a sense of freedom that they can envision. And then they have traditional expectations about whom they will marry, when they will marry, whether girls will be able to pursue a career or not pursue a career. And it engenders a great deal of conflict as well as backlash, right? And some of that backlash is playing out in the African continent. As you see, it's generational, and it's a different image of the ideas about how you get to pursue your dreams and who gets to decide how you pursue your dreams. And I wonder if you think that is that the picture that's playing out that turns up in things like, the criminalization of homosexuality, or the backlash against progress on genital cutting, or is it that basic at that family level, or do you see it differently?
That is an interesting question. So I think from a civil society perspective and from a youth-led civil society perspective, we find ourselves in a very tedious position. It's a tedious position where we are figuring out a world that is between fighting the old and building the new. And I think it plays out at a variety of levels, but in many cases it is informed by the dramatic disparities, generational disparities that currently exist on the African continent. The average age of an African in Africa today is 19 years old. The average age of a parliamentarian is between the ages of 60, 70, 74. So those who are writing the laws and crafting the legislation currently aren't necessarily able to think about the needs and the aspirations and the concerns of this generation or future generations. And that kind of gives me a great deal of anxiety, I won't lie. We heard the speaker from Thailand speak about universal health coverage and the incredible strides that have been made in that country. Many African countries aspire to replicate what Thailand has done in terms of managing fertility in a complex setting. The Asian tigers, I think they call them. However, where we find ourselves struggling at the moment is Africa is racing towards embracing universal health coverage. I think in the recent SDG report on SDG 3, Africa was said to have been the region with the fastest growing programs and policies and legislations towards universal health coverage. But again, the disparity there is when you talk to a minister or Ministry of Health around how they are considering adolescents within national health insurance schemes, they don't want to talk about it. The knee-jerk reaction is, oh, those are young people who are under the age of 18 and therefore they are children and therefore they should be on their parents' medical schemes. And then you get a bit more nuanced and you ask about, okay, well, what about access to contraceptives or access to reproductive health education for these adolescents? Do you expect those services to be procured for the adolescent through the parents' medical health scheme? Are they going to be covered for those services? And in many cases on the African continent, what you're already seeing is you have incredibly restrictive legislative and policy barriers that very crucially have age caps, minimum age caps. So for instance, there are age limitations on access to contraceptives and access to family planning services and access to even HIV services. So there's a lot of work that needs to be done and advocacy that is needed in particular to overcome some of those barriers. And I think dialogue and keeping progressive African consensus, again, like the Addis Ababa Declaration, front and center of the political discourse is immensely important because those are African agendas that have been agreed to by African leaders. And in many cases, we are hearing, oh no, SRHR, homosexuality, these are all Western concepts that are being imposed on the African continent by the West. In many cases, they're not. These are values that are rooted in what we refer to as Ubuntu and the reflections of ourselves in other people and our duty to promote rights and choices and dignity for all Africans and for all people in their diversity without distinction of any kind, as the POA has so succinctly deduced.
Thank you. So, Honorable Begum, I will let you have the last word. We've covered many ideas that you can pick up on, including technology, including how information flows and how we and where the conflict lies. It can lie as deeply as just the family structure itself. And you raise conflicts as well, so there's many grounds for you to pick up on. So let me just let you finish with what you see as any key points you want to end with.
Yeah, well, thank you. I think, as I've mentioned, I think resourcing and availability seems absolutely key. I find myself often asking the questions, you know, are young people able to access what they need, and are they aware that they can access what they need? And I think, like I've touched upon, I think it's also important, and I think Montserrat actually mentioned it as well, I think it's really important to think about sexual and reproductive health in relation to general democratic rights and economic freedoms as well. You know, it's got to be set in that context. Redressing inequalities, fighting for good health for all requires a collaborative approach, also a holistic approach that has been mentioned today. An intersectional approach is really, really key. I think reflecting on, again, the Global Youth Dialogue and on ICPD 30, I find myself asking the question, how are we including young people, adolescents, in a way that is grounded? How do we move away from problematizing them and ensure that there is a respectful partnership in achieving goals around SRHR globally? So meaningful engagement with youth is absolutely critical. It's not, I don't think it's an additional nice thing to have in this work for all of us. It's absolutely critical to achieving those goals, and I think that's the way forward in many ways. In my view, is initiatives that really do put young people at the heart of this agenda in a way that is meaningful. But also, I would just end on this point. When coming to this session, I was thinking about the access to information for young people. As a survivor of gender-based violence, I think what was critical in terms of me being able to understand my experiences at an earlier stage in life and that critical period of being young was the availability of information that was available to me, to be able to understand those experiences, to be able to relate it and to identify something as abuse. And that was only possible because of just basic information that was available, particularly from organizations and sectors dealing with gender-based violence. It gave me the language, the tools, the information, the advice. And sometimes it's something as simple as that can make a really, really big impact. And I say that because, those ages, the adolescent age and that young age that comes just straight after being 19 is, the experiences of young people, what they experience, but what also they are exposed to, has, as we know, a huge impact, often an impact that can be lifelong. So that's I guess, where the work is for us to continue to do. And I'll end there. Thank you.
Thank you. Just a round of applause for their panelists, please. Dr. Alate.
Great. Thank you very much. I mean, I just feel an enormous sense of pride and hope for the future. Very often I tell my staff as well that I feel like we're using granny technologies for our grandchildren that are not here. And it's incredibly hopeful that we have voices like yours that can actually engage in all of these areas that can disrupt. And I think we do need a little bit of, not a little bit, if you left it to me, we need a lot of disruption. And I really do want to encourage you and encourage all of us to see how we can create the sorts of spaces that allow the conversations to come together. I mean, it's hard enough for us just working in health, even just trying to retain the line of comprehensive sexual and reproductive health, that you can't, and as you had just said, you can't break down one of those and expect the others to work. It is a cumulative experience. We are all sexual beings, and we have to make sure that the services that are available, that the experiences that we have, that the protection of our rights are kept together with very strong evidence and realized and protected and so on. But being able to have those conversations together with the realities of what the future holds, the conflicts, the climate change, all of those, we just don't have those spaces often available. It is up to you with amplified voices now to really push us and hold us accountable, use the opportunities for the Summit of the Future and so on, for us to really have these discussions and think differently about how we provide services, how we think about what needs to be done, and so on. So on that note, I will hand over to Will to do a roundup and summary of everything and tell us what the next steps are.
Thank you. Everything is a good task because it was very rich, especially the last panel was just excellent, I think. You mentioned technology, you mentioned marginalized groups, climate, innovation, mental health, and so many issues we have to address. But let us also celebrate a little bit. We have really decreased maternal mortality. Unintended pregnancy has fallen in the last decades. Also, modern contraception has increased. So there's also space to celebrate. But I'm very happy to see Monse here and Levi, because the last time we met was in Benin, where we had the youth dialogue. We had 400 young people together, and they created exactly what Levi was showing earlier, which is the Youth Action Agenda for ICPD 30. And I have many copies here. You can just get them here from here. Go through it. It has been crafted by young people, and I was really amazed about the process. And, it was just amazing to see how the discussion went. And exactly the things that we discussed here were addressed by the young people in Benin to bring forward. It also shows that we need a life course approach. It was also mentioned that in parliaments, we have representation of probably older folks compared to the young generation. That's the future generation for us. And so what we would like to do as UNFPA together with partners is to bring this declaration forward to the Summit of the Future. And it will be part of the discussions at the UNGA. So for those of you who will be around in autumn, it will be very interesting discussions we're going to have. I hope you enjoyed this discussion as much as we all did, and I did as well. And I want to thank all the panelists for your engagement and the rich discussions. And for now, we're going to close here, but it continues with networking and discussion. And there's light refreshments, I understand. So let's keep up the good discussions amongst ourselves. And thank you all for coming. Thanks.